welcome to this video. I'm Dr. Clive Jones, and today we're going to be talking about the psychosocial considerations and implications when returning to work or sport after an injury. And not just returning to work or sport, but just returning into normal or as much as possible normal in the rehabilitation process of injury. Now, obviously, when treating an injury, a primary focus for many health and allied health professionals is the actual physical aspects of the injury. And what we're going to be talking about here are the psychological and social implications of the injury, which also need to be taken into consideration. And it's very important that anyone treating the physical components of an injury are fully aware of and accommodate the psychological and social implications of the injury as well. Mainly because if the psychosocial components of the injury, if they're not being worked on effectively, and if they're not being effectively sort of moved through, then it's going to inhibit and really impact on the overall recovery and rehabilitation of the person and how well they deal with what they need to deal with in order to move to a better place in the injury recovery process. So, it can affect things with motivation and compliance. It can have a person become despondent to any rehabilitation treatment that they require. And so it's very important to be on top of and aware of the psychological and social implications of injury. Okay, so what we'll do now is list the key areas of focus that we'll be looking at in each of the separate videos in this particular online professional development workshop on the psychology of injury. And this particular workshop is looking at psychosocial considerations of injury rehab. And the first video following this one will be looking at categories of reaction to injury, as in the psychological categories of reaction to injury. And we're looking at 3 categories here. Then we're going to be moving on to loss and grief of injury. There's quite a lot of loss in injury, and we'll be examining that. Then we're looking at other emotional reactions, particularly fear and anxiety, which is quite a common emotional reaction to injury in many instances. Then signs of poor adjustment to injury. There are quite a number of signs and markers that can help to give a heads up as to how well the person is coping with injury. Then we're looking at phases of injury rehab, psychological phases in particular, and there's 3 phases there that we'll examine. Then we're looking at the collaborative rapport that's developed between the patient and the treating specialist, an important component in injury rehab. Then strategies of coping, particular psychological and social strategies, the psychosocial strategies of coping with injury we'll be examining. Finally, we'll offer a summary and conclusion to this particular online professional development workshop. So you can see here that there's quite a number of topics that this workshop is going to be looking at, and each topic area has its own separate video